Well, maybe I'll start. Maybe we can introduce each other. Why don't I hand off? Maybe I'll start by saying thank you, everyone, for attending today. And today's talk, we're gonna have a conversation about patient portals and do they actually promote patient or health equity. And a bit of this format at Verto, we often have internal rants. We found that's sort of a useful form of ideation and thought. So this flows from one of our internal rants, so that we find them actually quite focusing on issues at times. So maybe I'll start. Ivana, I'll let you introduce yourself, and I'll go next.
Okay, sure. Hi, thanks so much. So my name is Ivana Marzura. By profession, I am in software development and delivery, spent my career in technology, but passionate about healthcare, and that primarily comes from lived experience, as well as professional experience, mostly through implementations and solution development and delivery for healthcare organizations. My interest as a patient advocate is to really look at how we promote technology to support individuals to engage in their care. And I am currently sitting on Verto's medical advisory board as a patient representative.
Thank you. I'm Mike Anderson. I'm Verto's Chief Medical Officer. I practice surgical oncology and palliative care medicine, and I work in a health equity space. So I'm generally quite attuned to the aspects of healthcare that inherently don't promote health equity, and I'm attuned to that. Often in spaces of technology, innovation often worsens or widens the equity gap before you get to a point where you can reduce it. So as we design things, we often miss the health equity piece. We design fantastic tools in healthcare for a limited set of people. So we're really quite interested in talking about patient portals today. And one of the things I think Ivana and I both were talking about beforehand is I have searched the literature to the best of my ability, and I can find nothing to suggest that patient portals have done anything to improve health outcomes for people. And despite people often saying we want portals, we want access to information, it's really hard to show where there's benefit. So the question becomes, why is that? So I'm going to put this slide up and sort of frame these to start. Health equity, this is just sort of language we'll use. Equality is the idea that everyone gets the same support. But as you can see, not everyone needs the same support. If the barrier to equitable access is the same, then giving everyone the same support doesn't help people. So the middle screen in this is the notion that equity is giving people the support they need to overcome the barrier. And obviously the last slide, justice, is the state where the barrier is removed. So we're really at this stage talking about the equity piece is how do we overcome barriers for people? So that's sort of the setup of this. And the first statement is that patient portals, although we tend to think they're an all-encompassing good, we haven't been able to show that they have a big impact on health outcomes. And we also have to be attuned that innovation tends to worsen equity in many spaces before one comes to the space where you can reconcile this. So patient portals, what have they done for health equity? And Ivana, maybe one of the first places we want to start is about the notion of their unidirectional. Who do they serve?
Yeah, so that's an interesting one, which is portals, I think, are an important start to providing information. However, the implementation has been really to just literally provide information, and not to really think about, what that information is being provided for and how it's being received, and what the needs are. And so we have information pushed to us, but potentially it's not very useful for the kinds of things we want, and it is really one way. So if I have questions about a report, or if I have some things I want clarified in my next visit, I typically can't communicate that in the portal. And I remember a story of visiting a clinic where I was just starting on a series of treatments, and I was noting things that I wanted to discuss in my next appointment, and kind of there was a space in the portal, and I thought, oh, this is great. There's a space to put notes, and I put all my questions in there, and and then I went to my visit, and I said, oh, I'm really glad that I got to be able to put my questions in the portal. I'd like to discuss them. And I was met with sort of a blank look and said, oh, we can't see anything you put in the portal. So luckily I had a printout of what I wanted to talk about, but it really sort of illustrated to me that, there was this missed opportunity to use the portal as an engagement tool where, we could better prepare for a more fulsome discussion at my appointment, or just have it be a place where I noted things that I might forget to ask when I arrived. But yeah, so they're very unidirectional, and from that perspective, we're getting information, but not really able to use that information in a way to then promote engagement, if that makes sense.
And I would think that one of the barriers to use of portals is if you don't perceive there's some action, that you can achieve out of it, that it's just this passive information relaying tool, then where's the value in it? So I think that's and I think one of the things that maybe has been a sort of a neat byproduct of all the changes through the pandemic has been we've started to afford people the ability to do things like book their own appointments, even in the sense of, can you book your own COVID vaccination? Can you book a test? Really, there was limited scope for that before. Bookings had to be filtered through the lens of the healthcare provider. So, I certainly think we're starting to see some places where actionable things could occur. So if you take the position, if we're going down the avenue of communication and the ability to have these bi-directional tools, then I think the next piece becomes, how do people want to be communicated with? And I may presume as a health literate, technologically reasonably adept person that these tools are useful to everybody, but they're most certainly not. So the next piece becomes, do we understand and meet people where they're at in terms of communication tools? So we talked about the most useful one, which we kind of forget in these conversations.
And it's true. It's surprising to me that a very simple thing in a portal might be to be able to specify how you most prefer to be communicated with. But my experience with different portals has been that it's all predicated on email, which may or may not be the most effective tool for individuals. And I think we need to be cognizant that people have different ways that they might want to communicate, whether it's SMS, secure messaging, it could be telephone, it could be in person. So I think, even small improvements to being able to sort of specify the best way to communicate, and then to make it really easy for providers to have integration with those methods of communication, would promote, I think, the ability to have, a better connection between patients and providers.
And I often see the equity piece offloaded onto individuals, like it's their issue, that it's the issue of the patient not having access and so forth. And I wonder if what we've often done is offloaded the system responsibility to design things with people's, meeting people where they're at in mind. So we sort of say to you, this is the one way we're going to communicate, as opposed to what works for you.
Yeah, and I think interesting if we look at our experience with virtual care, we virtual care in Ontario has been around for a long time, and this is a little divergence, but basically, it was very restricted in terms of the type of platform that could be used for virtual care prior to the pandemic, and then in the pandemic, temporary billing codes allowed a much broader use of technology and included SMS, email, and telephone. And in fact, telephone ended up being a big one of the actual primary forums for virtual care because it's accessible, easy to use, et cetera. And it was often sort of a first entry point before a virtual visit or an in-person visit. So I think even with portals, if we look at that lesson, maybe the lesson is that, broader consideration on how people communicate and what they have access to, or providing options for access, then also supports increased use and access in the portal itself, right? Telephone is not going to increase your portal use, but at least we understand that portal is then not really a current option if someone is preferring to be in person or telephone. We know that the portal is only going to have a limited impact for those individuals.
And you've often reminded me that other industries that outside of healthcare do a much better job of the notion of knowing their customer or knowing who they serve, for a variety of reasons. We don't invest always the same effort in understanding who our customer is, for lack of a better term, how they want to be communicated, what's relevant to them. We just kind of make this blanket assumption and push it forth. So things like, do I want to be communicated with by telephone, by SMS? Am I willing to email? What works for me? In an equity space, it's always interesting to me that designing apps and portals have a pitfall in that groups of people who don't inherently have a high degree of trust in systems and healthcare systems, in this case, don't like using those resources. So we effectively, again, in our system design, we exclude people. So we may say it's about the individual, but the truth is it's in how we choose to design things.
Yeah, I agree. So, for me, if I think about the use of technology in healthcare to promote an individual's engagement and ability to manage their own care and participate in their journey, the one overriding thing I always think about is how do you safeguard care for people who can't or don't wish to participate in the technology? So I think we always have to keep that top of mind when we're thinking about designing processes or tools, right? But then I think the other thing that's kind of a basic principle around supporting access and use is also that we need to think about how to make things clear and simple. And this is not just for patients, but also for providers or anyone. And I kind of think of when, I had my first child and, went to the mall, and it was early days and I had a big stroller, and, and I realized that, we often think about ramps for accessibility for people potentially with disabilities. But, really, if that additional access made it easier for me as a mom with a stroller, makes it easier with somebody who maybe has, a mobility issue, or, just in general, if you don't want to walk up the stairs, it might make it easier for you to have access. So when thinking about design of these systems, I think we also maybe don't spend enough time thinking about how do you actually simplify and clarify our presentation of information or design of information. And thinking about portals, right now there are big repositories of information. And I was looking at one of my portals the other day which has information stretching back over the past probably 8 years. And it's really just a long list of reports and results. And I was kind of thinking about the fact that if there was a more sort of visual representation, maybe a timeline that showed clustering of things together and allowed me to drill into them, I could kind of see where sort of episodes of more involved care and engagement were occurring versus sort of like heartbeat follow-up types of things, and sort of picking on what I needed to focus on to prepare for whatever's coming next, right? And that timeline could even include what's coming next in terms of planned appointments that might be 2 years out or that kind of thing. So I think in terms of equity and access, thinking about design, simplicity, and just maybe more visual information would go a long way in terms of helping people to understand what's in their portal.
Yeah, so I think that's, pardon me, a big piece of equitable design is the simplicity of it, or that that it is not so complex that it's useless. And it's funny you talk about the other side of it, because one of the challenges, so as a physician, we drown in data lakes of electronic health records, and it's hard to sort out, to contextualize things and find what's relevant. And that's speaking from the most privileged position of access to this information. So if I struggle to find the right information and contextualize it, how can I possibly expect that that will be apparent, that people, that health consumers, patients, families, caregivers can sort through that? So we have to go back to the design. The equity is built into some of the design. That's even before, we're talking here about complexity issues, I think, and being attentive to different people's ability to manage complexity, but also things like language. Is it presented in a fashion, whether it's visible, whether it's graphical? Is it presented in fashions that are accessible to everyone? And I don't think currently that's the case typically.
Yeah, I agree with you. And I wonder, when portals are being designed, if we're really thinking about what they're being designed for, and asking the question of, what do we want to achieve with a portal? I think, maybe the primary objective right now is providing this point of visibility to things like your records, obviously, your reports, your labs, your appointments. And that's great. We need that. That's a start. It would be better if that information could somehow be integrated. And I'm not talking about like one giant portal across all Ontario, but if we had, portals had the ability to incorporate information across portals, so digital front door kinds of things. But we, to really make them effective, and I think to sort of see whether or not they have the potential to support better outcomes, we really need to be thinking about these portals as tools to help manage care, and also just to have better understanding of your condition, the trajectory of whatever it is that you're experiencing, what next steps are and what actions are, potentially to inform about options and have forums for discussion. So that's a very different thing. That's not just a portal to see things like a doorway, or maybe it's not a full doorway, it's more of a keyhole into one aspect of your record, because we're looking provider to provider, and often some tools are limiting how much you see or how far back records go. So it's not an electronic health record. It's really just a point in time and providing you with a lot of data. So I think if we start to think about access and use, and maybe this starts to address something that I see posted in the chat from Rowan, which is that the scope of the portal is a really big factor in what impact it's going to have on patient outcomes. And I think that speaks to the fact that right now the primary purpose of portals seem to be to give us visibility to our most recent labs and records and what appointments are upcoming, but doesn't really give us the tools to participate in care. And some of these could be simple things. You talked about emerging scheduling systems, but I think that those are still very limited, right? They have been offered more around things like COVID test bookings or vaccination bookings. We're starting to see it for flu and potentially other types of immunization bookings, which are great. But there's a lot of other things, going back to that passive nature of the portal. There's a lot of other actions someone might want to take, right? They may want to be able to accept appointments or to look for alternative times, maybe not fully make my own appointment, but at least be able to choose from some alternative times for appointments. Or I might even want to correct something in one of my reports that I've just read that isn't quite correct. And, that would sort of start to allow for interactions with the system from the patient perspective. If we start to think about, I'm pushing information, what might a person want to do with this information or need to do with this information? And then can we enable that in the portal? So I think that would promote then better engagement. Still may not address equity issues, although it does sort of put me on a better footing to be participating in my care.
And it's looking at the US space, because there's more uptake of portals, but it's driven by a mandate. I think it's the High Tech Act that basically says, there's a reward for having patient portals, but the only measure that drives it is, do people log in? Do they have a username? So I thought, sort of thinking about the idea that the accountabilities you build into it when you design it also inform what you design. When your only accountability is, yep, people can log in, there's no link to anything that is perceived to be beneficial. And frankly, on any side in that respect, whether there's anything that patients and caregivers perceive to be beneficial, providers perceive to be beneficial. So the accountabilities you build into it also have drive the direction of development and of use. I might just change tack a little bit, because one of the things that in an equitable sense that we see is the notion of your circle of care, who can access the portal, because often the patient themselves may not be the person accessing a portal because of either health literacy, technological literacy, any number of reasons. But currently, the only thing one can do really is give your password and your username to someone else. So they have delegated complete access. They have binary, either no access or complete access. And wouldn't it be interesting to start to have the ability to delegate variable levels of access to people in the circle of care, because you might need your child, your partner, to do certain things for you, but you may not want to display all of your information. And to my end, I don't see that as a functionality that exists yet.
Yeah, and I was looking at that as well the other day, and there is a function in one of my portals to share my records and access to my portal by inviting someone by email. Um, in itself, that is a little difficult sometimes because one of the things is you have to know somebody's email. And as a patient, I don't always get information about my provider's email. In fact, it's more common now, but not across the board, I would say. That's not something I usually get is, oh, here's my email me kind of thing. And then the other thing is that, you may share, let's say, with your primary physician, let's say in a clinic, but then, is that getting shared with others within the care team in the clinic? So, I think, yes, right now it's kind of all or nothing. And often people are sharing their full credentials and access because that's the easiest way to give that access. So I think, yes, we could probably make improvements. And I do see managing consent in a circle of care and figuring out what you want to share with them could be complicated. And it just generally is when you're thinking about who permissioning schemes and who gets to see what levels might that be. I think that would be an area that would require a lot of design thought to sort of help people to be able to do that, right? And it's kind of part of it is like right now I have to know everything about my circle of care, and I would have to be the one who initiates that. But if my portal is pushing information to me about what care I'm getting in, the system behind the scenes knows a lot about my providers as well. So maybe improvements there could be that the information about providers is sort of presented in some kind of interface to help me sort through that circle of care that's already established in the system versus me having to sort of think through, okay, who are all my providers and whom I want to give access to, and do I have their email, or now do I need to follow up with the office and call and get email addresses, et cetera. So, I think it is a good point. I think it's a complex area that requires some design and also more help to pre-populate sort of the list of people that are already in your established circle of care.
But again, that goes back to the notion of you have to know your client or your patient better, because the truth that no one likes to really acknowledge is a lot of things like this get managed by giving your username and your password out to people. We say keep it to yourself, but then that limits you. So people share them to make these things work, and I think that's a piece we should kind of acknowledge and say that's something we have to be thoughtful of. It almost makes me step back, and I don't know the design of many portals, so I'm not sort of making a blanket statement, but I often wonder how much true co-design went on, because and when I say co-design, I mean that with a real broad spectrum of positions and voices and approaches, because to this day they still strike me as being well designed for a connected, literate group of consumers, and not particularly well designed for anyone else. So what does the design process look like if we're, if particularly because, as I said earlier, I think we often say, well, the equity barrier falls on the individual, without taking accountability that the equity barrier can be addressed also from the systemic side. So how do we design?
Yeah, and I think that I'm not sure how much co-design there's been or how much thought there's been to who is looking for this and what are people really trying to do with these portals? And and that does include a broad spectrum of people and roles and abilities, and literacy, and I think that maybe stepping back and saying, what is the portal for? Is it enough to just push information out, or do we really want to start to promote that literacy? And we could start with health literacy, good contextual information and resources that are provided in very consumable ways, whether it's a short video or some a short article or an experience that's shared, to promote literacy around one's health, or what's, if you're on a care pathway or a new journey, maybe what that journey is going to look like, to inform people, just to have them better prepared for their own care, and for discussions about that care and what it means, and what the possible things that implications or impacts are going to be, so that they can plan for themselves and for families and caregivers and all the rest of it. So I think I guess my point is, have we really thought about, again, the scope? What is the scope of the portal? What are we intending it for? Is it to meet a metric in an act that says you must provide a portal that a patient can log into, full stop, there you go, here's your login, you now have a portal and you can see appointments and records? But personally, that leaves me wanting a lot more. I've always wanted a lot more, and I have a privilege of being tech literate, health literate, and interested in being involved and engaged. But I think a lot of people do. And so I think the question we should ask is, how do we start to involve people and think about, what is in a portal and what is it for, and how do we actually start to allow people to have more direct access, management, involvement? Because I think in the end, what everybody wants and what promotes better outcomes is really good discussion, engagement, and communication between providers and patients. So, if I know more about what's happening or what needs to happen, I probably will personally be, thinking about, are these things happening? If they're not happening, how do I get them to happen? What do I need to know? So, all those things are going to, I think, promote better outcomes, because they allow you to take control and to advocate for yourself. But I can't do that if I don't have clarity, if I don't understand, I don't have information available, and I don't have a process to communicate effectively with my providers. So I think that there's lots of potential to sort of think about what are portals for and expand the use. And maybe we don't call them portals anymore. A portal is kind of a doorway, but if it truly is a portal and a doorway into a system, then it should help us to understand and to see and to navigate that system. And I think that maybe that's what's lacking right now, is that ability to navigate and interact with the system.
So when I think about this, maybe one of the challenges, if I was going to try to make the portal concept equitable in terms of access, I would sit there as a provider and I would, what happens now is we give people, set up your account, here's your username, password, go forth. And if I really saw value in it, I would probably have somebody, hypothetically in my clinic, who would sit down with people and, say, let's set this up in a way that works for you, so that the visual representation, what you have available to you, aligns, the language aligns, the access aligns. And if it really was a tool that we were using effectively, then the provider side of it would say, okay, there's value in this for the provider, and there's value in doing this for the consumer. So we'll work to bridge that, and we would invest the resources to help you set up a portal to make it functional. But maybe what we have baked into this is a sort of a tacit acknowledgement that they're not really that useful. So we're not investing the effort in making it that useful, because we go, why would I have a person in my clinic sitting down setting this up for people if it's not really going to change their care, or or our ability to have a therapeutic relationship, because all it is a a window into endless, into your electronic health record, or into endless information. So maybe the piece of it is the equity piece can, the equity piece is still going to involve, it's going to involve the human interaction with technology, not the technology. And we're not invested in it yet because we have yet to see the value in it. Once the value is perceived, maybe that's where we start to say, we will take the time to help people tailor it to their needs, to their context. But we don't do that right now. We say, go, set up your email, enter your email, enter a password. Here you go. This is what you got. I know you went out to the restaurant tonight and you felt like you wanted steak, but I'm sorry, all we're serving is cabbage. That's all you get. Sorry. Yeah.
And it's really interesting you make that point, because I was looking at some studies this morning, and there was one study, and that was one of the key recommendations they were making, is that, to promote the use and better engagement from patient perspective, one of the most effective tools is to provide in-person support for how to use the portal. So it is exactly that, not just sort of saying, here's your password and your credentials and the site you need to register at, but actually sitting down and talking about that, and then really thinking about, as you sort of start to, design these portals, to really think about what is supporting use and addressing what are the barriers and how do you address them. So maybe it goes back to this question of what are portals for? How are we designing them? Do we see them as valuable for engagement and outcomes? And I think, my sense is that yes, more and more we see portals and patient engagement as really important, and we see efforts, albeit often slow and limited, to support better patient engagement. But yes, we all have to understand where there's buy-in and consensus, and how do we actually sort of say that, yes, this will lead to better outcomes, or these are important things to do. And then perhaps if we can sort of start to demonstrate that, then we'll have more buy-in for actually achieving some of the things that we've been talking about, which would lead to less passive, better tools for communication and engagement.
And one of the things that we were talking about is the complexity of setting up different layers of consent around access to information for a circle of care. But I fully disclose, I don't actually love the term patient-centered care because it presupposes that care happens for an individual in isolation. So we make it the point of contact of the individual can have access. But the truth is, most care around healthcare is really community-based. People don't do things in isolation. They have family, they have support systems. Support systems do not always look like what we presume they look like. It's communities and who your supports are highly variable. So when you work with people experiencing homelessness, the circle of care may not be your sibling, your child, your spouse, but you have a community who cares about you and who will support you. But our preconceived ideas of what a circle of care looked like tends to exclude people. So I really also think that the notion that the portal is a sort of a connection only between a patient and a provider is a little misses the nuance of the real world. So that's the sort of thing where you do need to invest in the people support to help develop, to help make these tailored to meet people where they're at. So that's, it's interesting. Technology is a fantastic thing, but you have to manage the people part of it, and you can't forget those two are so related.
Exactly. That's true.
I should probably be a little bit attentive to leaving some time for questions. Ivana, is there anything we have not, anything major that we have not even come close to yet? Probably there's a few things.
Sorry, do you mean in the portal?
Oh, yeah, any topics in the portal. I mean, I always think of one I have flagged as, I know when we've talked before, is too many portals. But you sort of mentioned the idea of a digital front door or something. Yeah.
I mean, I think for me, if I can sum it up, it's really about if the portal is really for patients and their caregivers, then have we really thought about what they want to do, and how are we delivering that? And I think that the answer is probably not. We haven't, if it is a patient engagement and a tool for management, then no. And how do you do that? How do you promote that? I think that there's areas that we need to think about: contextual information, promoting understanding of your health condition or the trajectory or the care path, helping people be better prepared, two-way communication, management tools, and eventually maybe we'll get to the point where we have things like insights based on data that's being collected or contributed. And when I talk about bi-directional flow of information, or when you do, it's not just the ability to sort of put my comments or questions into the portal and have them seen by my provider, but it's also could be things like remote monitoring, or my Fitbit tracking data is also being contributed, should I wish to do that. And so, over time, maybe if we've got better integration of information and more sources of information that we can contribute, we can also start to leverage technology to provide insights. But that one's really far away. I'd be happy to just have a little bit, as a first step, to be able to action some simple things. I think it would make me a lot happier. And then I'm happy to do incremental, small, positive steps towards a much bigger vision. Yeah,
I think I heard a couple of overarching things. The portals have to have some value, some perceived value. So there has to be something actionable out of them rather than just a passive tool. We have to understand the co-design idea is we actually have to understand the people who are using them and how they want to be communicated with, how they want it to be, information to be presented, what they want it to look like. So the voices, and by that I mean a really diverse spectrum of the voices of people who would use these types of tools, need to be present in the design process. And we've got a ways to go, but part of having a ways to go is having a bit of a vision for where you want to go.
Right.
So I think, being mindful of time, I should stop and open this to any questions.
So maybe while we're waiting for questions, maybe, as a provider, Michael, when you think about this, I know you think a lot about people and equity and access. What do you think is maybe an initial small step that we can take that would, from a provider's perspective, support this question of outcomes or engagement or richer partnerships between you and your patients?
I mean, the very first step is actually listening to what people want. Like talks to like, unfortunately, too well, and we often don't listen to things that don't sound I often talk about the notion of it's important, if you want to make change, it's important to become comfortable with being uncomfortable. So we sit in spaces where we talk the same language and we see things in a similar fashion. So I think that part of making this valuable is actually doing the work of hearing hearing from voices who often aren't heard in healthcare. And I should even step one further and say that we continue to design systems for a relatively privileged part of society, and we continue to design them without the voices of others. And in fact, when we look at what happens in healthcare, is the voices that aren't heard actually often are high consumers of healthcare resources, and yet we fail to design things with them in mind. So I go back to the process of how we design these. They need to be done in a partnership, and we need to start working in uncomfortable spaces to hear voices and perspectives that are just excluded right now. So I think the design piece matters, and that relates to functionally, what do portals look like, and how do we communicate with people? I often think it's kind of interesting nowadays that the healthcare system will often support fancy technology for people, but we won't support giving people the most basic thing they need, which is a cellular phone or some way to communicate. So yeah, we have some really simple things we can do, but the first is listening to the voices that are excluded right now.
So that maybe, Michael, leads into a question that I see in the Q&A. So I'll just read it. It says, how can we make sure people's users present during the design stage of the app apart from surveys? So this is, how do we get people to the table? And I think that's hard because if we just think about it, there's a lot of diversity. So how do you bring, those voices, and not just, one or two representatives to the same tables, or the same representatives to multiple tables? So I think, surveys are part of it. I think that some organizations, or there's opportunities as we move forward, maybe whether it's, organizations reaching out to communities. I think, during COVID, we saw a lot of this community involvement in understanding what people needed in times of, as COVID testing was rolled out, or as vaccination was rolled out. So there was a lot of engagement of community leaders and community partners. So I think that those are excellent forums for tapping into understanding people. So really making an effort to reach out.
But we do it. So the challenge is, what we're calling engagement continues to be done from the perspective of the system. And when I say that, I mean, I'll give an example. I'll sort of anonymize it, but there's a community health clinic in the city that had various institutional healthcare settings, going into the community and with an initiative, and it just never moved. Nothing ever moved. And because the institutions were doing it from their lens and the way they thought. And eventually they did the wise thing, which is they went and talked to the community health clinic that knew their community well, and said, how do we make this work? And they said, oh, well, everything you're doing is fine, except it totally falls on deaf ears. There's no trust there. You're communicating in a fashion they want. So they actually went about it differently. They said, well, we have key community leaders who are trusted. And when we talk to them, it turns out all of a sudden they had sessions where they had 200 people present. And then before they'd go and put up flyers and emails and they'd get no one or one person.
Yeah.
So we engage often through the lens of how we're used to. We send surveys. We expect you to come to my hospital or my committee room. Well, if you don't have we fail to do the work of going and meeting people where they're at, which is, this may be in your community center. This may be occurring around, if I really want to understand what your needs are, I need to go to your cultural center or your health center or this, but we tend to say, come to us. to our space, do things our way. So, and we think, well, we've engaged people, we didn't hear the voices, they must not care, but we really never communicated or went to them. So I often think that engagement as a concept has to happen in the community that you're looking to, have a relationship with, rather than say, come to my space, and all the visual cues then say, everything then says, play by my rules. So I think the way we engage matters, and we don't do it very effectively.
Yeah, and I completely agree with you. And I think that was part of the point I was trying to make, is that you getting into the community and not just, and being a listener more, and allowing the community to guide you um, by asking questions and really listening to what is it people need or want, or where are their barriers and challenges, and then, how can people be better served? And maybe that leads to the next question, which is that given the vast number of patient portals available through the healthcare system, do you think they're the most effective platforms to integrate data sources like clinical notes, wearables, et cetera? And I would say that not necessarily. It's hard to sort of say, I don't think, first of all, one place, like there's one mechanism to do these things. With technology, you have opportunities to have multiple places where we can have interactions, and that in itself increases complexity. So I don't think I have an answer for this one. I think all I can say is that portals are a mechanism that are here, that are supposed to be a tool for patients. So what I would say is that if we do want to make those effective tools for patients, then we really need to understand and co-design with patients. And I use that broadly because not everyone is a patient using the portal at that time. It could be a caregiver. You could just be, navigating or touching, base for a follow-up that happens, 2 years from now, whatever it is, refreshing your memory on something that's happened in your past because you forgot some dates, whatever it is. We have this portal, we have a place where we've sort of defined that individuals are going to be able to get information there, but we haven't done much to then think about it beyond just a repository of information. So as a first step, maybe using portals to have a place where we integrate more of this information is a place we can start. But then I would expect that, just like all technology and systems, that we evolve and adapt based on what we see is working and where things are appropriate. So that's the best answer I can give, because I don't have a crystal ball.
And I'm not sure if I'm expanding or even answering the question that was asked, but one of my thoughts is that just giving people access to unfiltered, endless information, it actually is probably less useful than no access in some respects. So maybe the piece of this is, how do you give people access to summaries of information, or plain language summaries, or because it's sort of all the portals and all the access and all the information. We make this presumption that more is better, and I'm really not convinced in this setting more is better, but so sort of having that what's useful information. And that can't all be designed, obviously, from a system side, but the notion that what might be more useful to people is not everything that's typed up into a CT scan report, but an effective summary of that. And right, when we start to get to that point, then we can integrate things a little more, because we're not dealing with the huge lakes of information. We're dealing with something that's relevant and contextualized.
Yeah, and I completely agree with you, and I think that if we think about the opportunities there, it's how do you take the information that's being conveyed and pull out the important bits from it, right? So, am I trending neutral? So I'm stable? Am I sort of having to worry about things? Or, this is not an issue anymore. We're sort of, if it's in your past, you're done with it. here's the important things you need to know as part of your medical history. Or, the one that always gets me is, as somebody who has multiple providers for different things in different organizations, keeping track of what's supposed to happen 2 years from now. And often it'll be statements like, we kindly ask Ms. Marzura's physician to arrange this X-ray 18 months hence before her 2-year appointment or something like that. And it's like, okay, so what are the odds that the 2-year appointment's going to get scheduled and that the family physician's going to remember to book, not disparaging any individual. It's just like there's a time lag here. So, as I read those things, I don't, other than my personal calendar, I don't even have a tool to have those little things pulled out to sort of say, hey, maybe 15 months from now, I should have a reminder that says, make sure, you call the family doctor to get your X-ray arranged. And or maybe the family doctor gets an automated reminder or whatever it is.
But,
I dream.
You just actually made me think of something though. You know how, I'll tell you, so when you talked earlier about the portal being a physician side, think of that side too, or not clinician in general. The way we communicate is by notes, right? We dictate notes, they get typed, they get sent. I'm relying on the provider, the family doctor I send the report to, that somewhere in the midst of 2,000 words, they realize that I said, please arrange, a CT scan on this person's, back on this date. And why should I mean, I think I've transferred accountability because I've dictated this long note that has a few instructions in it, but there's no handshake to say that it's happened. I've excluded the patient from it because they rarely see that note. So we don't even have an effective form of that true handshake. Yes, I've handed off this to you. Will you do this?
Yeah, and it just kind of makes me think back to, the ramp made it easier for me with a stroller, just like it makes it easy for someone with mobility issues. So if there's something that helps me to be able to ensure that 2-year follow-up action took place, it's probably something that my provider wants as an aid to help to make sure that 2-year follow-up action takes place as well. So, I think it's just, these are big ideas and not, I think, in the immediate future, but it's nice to think about, what are portals really for and how do we move them forward to be real engagement tools.
Yeah. I think we've come up on 1 o'clock. Thank you very, very much. And thank you everyone who was present today for your questions and listening to our scaled down version of a rant. So
thanks everyone.
Thank you.
Bye.